Samantha Melvin, the ICU nurse manager.
Nice to meet you.
You want to come on in and have a seat?
I'm Ashley Davis.
Ashley, welcome. Do you want to start by telling me a little bit about yourself?
Yes, I am from Harrisburg.
Okay.
I have worked in a hospital setting for about the last 9 years, critical care probably the last 5 years.
Okay.
I love it. That's where my heart is. I've got 2 kids. That's really about it.
Okay. So what interests you in coming to Heron Hospital?
I've heard really good things about your corporation, about your benefits and kind of the opportunities that you guys provide. Really looking to grow.
Yeah. Have you heard a lot about our ICU department?
Yeah, one of my friends actually works there.
Oh, really? Who's
Yeah.
that?
Jenna Genesio.
Yeah, Jenna Genesio is an awesome nurse.
Yeah.
So what do you bring to this position? Sort of make yourself shy.
Well, I love patient care. I love taking care of the 1 to 2 patient ratio type thing. I like doing the individualized care where you kind of know everything about them. I'm a great team player. I really like working with my coworkers. I love to train people, learn new things, any type of education.
Yeah. So can you describe to me a situation when you had to deal with a difficult family member or patient?
Sure. Difficult family members, that happens all the time. So you just have to try to stay calm and listen to their problems. Try to provide any support they need. Make them understand, communicate with them, make sure everybody's communicating with them, doctors and so forth.
So I will tell you, at Heron Hospital, sometimes our census will drop and you'll have to be floated out to different departments.
Oh gosh.
You'll only go within your competencies.
Okay.
So how do you feel about floating out to different units that you may not have worked on before?
Yeah, I used to work on the medical floor, but I don't think going back there, I'd be a little bit intimidated taking so many patients. But I would just use my resources and ask for help, and as long as I felt comfortable there, I would be fine.
We do hand out float buddy packets, and we make sure you're comfortable with the department before you give in your team. So how would you handle an unexpected circumstance such as coming in and you find out you're working short-staffed?
Short-staffed. Well, you just do the best that you can, prioritize, just kind of tackle everything that you can, do the best you can, use your resources, work as a team.
So if I was to ask your current team, what would they tell me about you?
That I am a hard worker and that I take good care of my patients.
Good. So working in the ICU department, you will have some stressful situations, cats, codes, different things. So how do you handle yourself in those situations?
Well, you just have to stay calm and focus on what needs to be done. Be familiar with your surroundings and know where to ask for help. Be your patient's advocate and just make sure the right things are happening for them. Be up to snuff on your skills too.
So if I was to ask you about absences, such as unauthorized absences in the last 6 months, so call-ins, how many have you had?
Probably 3 in the last year.
3. I ask that because our attendance policy is very strict.
Oh.
So I like to be upfront about it and just let you know about it, that we do watch those and we do watch tardies.
Sure.
Do you-
Mostly for my kids.
Yeah. Do you have questions for me?
What does your ICU have there? Like what kind of skills?
The ICU has sepsis patients. We do get some overdoses. We do get some surgeries, big bowel surgeries.
Right.
Let's see, we do like suicide overdoses, pneumonia, CHF, COPD, so a wide variety. When flu season hits, sometimes we do some proning to patients and paralytics.
Cool.
We've started doing CRRT, so that's something new. We're up and going.
No heart stuff yet.
No
right?
hard stuff. Usually we transfer those to our sister hospital, Memorial. there's a lot of great advancements, and we're really doing a lot of procedures at the bedside, so you'll learn the skills on that, like on sedation.
Awesome.
So different things like that. The ratio, it is based off acuity, so that's how we do ours, all of our staffing. Your ratio usually ends up being about 2 patients to every 1 nurse. If it is a CRRT patient, you can have 1 patient
Okay.
if the acuity is high. And there is possibilities that you could have 3 patients if they're
Sure.
overflow waiting to go out to the ICU department.
Okay.
But we do have charge nurses that take the lower number of acuity patients,
Okay.
or no patients at all, so you do have those resources available to you.
Okay.
And there is me, the manager, and then we have an assistant manager that is available to help.
All right. Awesome.
All right.
Sounds good.
Do you have any other questions for me?
No.
Okay, the next steps is you've interviewed with me. Our HR department will give you a call. We'll do some reference checks. They'll ask you some similar questions, and at that time you can ask them questions.
Great.
If you have any questions about insurance or benefits.
Okay.
And then we'd set you up for a peer interview. Are you interested in days or night shift?
Probably night shift.
Okay. So when I set you up for your interview, it would be with the night shift crew.
Oh, okay.
That way you can
Right.
get the feel for them, and they can fill you out and find out if this is a good fit for you.
All right. Sounds great.
So you should hear back from me by the end of the week, and then final decisions by the end of next week.
Okay.
And in the meantime, if you have any questions, just feel free to give me a call.
All right.
All right, thank you.
Thank
It was
you.
nice meeting you.
Nice meeting you.